No, they wanted to recruit in our area because we were a hotspot at one time.
Plus, we have a large, diverse community, but that concept isn't working out as researchers had planned. Our health reporter Haley Hernandez is live in the Alief area to explain why in this week's Stronger Houston report. Haley?
Yeah, guys, the truth is that we do not have the minority participation that we need. And you would probably ask yourself, how come Houston couldn't get minorities to step up? You know, you ask any local doctor that, the NIH, the CDC, and they all point to the Tuskegee study. Black Americans did not want their children to go through that. They warned against doing medical research. And unfortunately, today, those warnings may have done more harm than good. But I spoke to several minorities, including one who grew up here in Alief, about how they're trying to make a difference.
I'm from the hood. We call it the slums.
Growing up in Alief, Chris Owar says he probably would have dropped out of school if it weren't for basketball.
I didn't have much. I was a kid that was syrup sandwiches, lights were off. The athletics got me to college.
After college, playing ball helped him travel the world and become a teacher in Fort Bend.
Looking at me now, I would go back in time and say, educate yourself first. Don't take my word for it.
He says if he didn't have that, there's no way he'd ever agree to participate in scientific research. But now he's received 2 injections as part of the Moderna trial.
When I told my parents I'm getting the vaccine, I'm going to the vaccine trial, they told me don't turn into a mutant.
He laughs, but these are real conversations happening in communities across Houston and across the country. Black and Hispanics are not signing up for vaccine trials. Here to explain why, Dr. Jean Raphael, who works with diversity and inclusion groups at Texas Children's Hospital.
I think it dates back historically to some experiments that were done using African-American patients, and specifically one that's most well known is the Tuskegee syphilis trial, where there was a study on African-American that was conducted for about 40 years on syphilis. And even when they found out that penicillin could treat syphilis, they never told the men.
But fear isn't the only thing holding minorities back. Sometimes transportation and work requirements don't allow them to take part. That's where the researchers are trying to use other enticements.
We definitely, value the time and travel, and so there can be compensation around $1,000.
According to the Texas Center for Drug Development, so far, less than 8% of the participants in the vaccine trial in Houston are Black. Less than 23% are Hispanic. That's nowhere near an accurate representation of our community that has about 23% Black and almost 45% Hispanic. And it means a vaccine will not come to fruition at this rate because no vaccine can be proven safe without testing on diverse ethnicities.
That's why this is such an important part of making that happen. It's a goal we all want, and it's a goal we all can work for.
But why should any minority think they'll be treated fairly in a clinical trial? Here's what's changed in modern medicine. Current studies are completely random. Nobody knows who's getting the real drug or a placebo, but every patient is monitored closely.
We're going to do the best to take care of you.
In the past, researchers were only giving the experiment to Black men. They were not transparent with their study. And Chris says today's trial is the total opposite.
This is nowhere near like the experiments that were in the past. If I can help somebody, I can help my community quickly get this vaccine and know if it works, to distribute out, to make us get back to normal, sign me up first every single time.
But why can't researchers just try the vaccine on those people who are willing without recruiting minorities?
Some medications work better in certain populations than others. So, there are these times where based on race, ethnicity, or gender, certain things have the potential to work better in certain populations versus others.
When phase 3 started, we had, unfortunately, predominantly Caucasian.
We want this study to reflect, a good number and a fair number, especially since both the African and Hispanic communities are disproportionately affected by COVID.
Yeah, because many scientists believe that the only way out of this pandemic is to get a safe and effective vaccine. The only way to do that is to have accurate representation of all of our communities. And that is where Houston minorities, you can make a difference for the entire country. If you're interested in participating, you should go to this article on click2houston.com. There you'll find out that you can also be reimbursed up to $1,000. And if you successfully refer someone else, you can add an extra $50 to that. Reporting live in Alief, I'm Haley Hernandez, KPRC, Channel 2 News.